Toads cause warts. Brown eggs are healthier. Juice cleanses detox your body. Are these old sayings fact or fiction? Backed by popular demand, we're going to debunk your medical myths today, as well as answer your questions here on this episode of Ask the Doc, no appointment needed.
Funding for this program is brought to you by Michael J. Zinner, MD.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage you, our viewers, to send in your healthcare related questions and our medical experts answer them. My name is Dr. Kamaljit Kaur and I am a board certified primary care physician. Let's get right into debunking some medical myths today. Our first question comes to us from Tanner, and Tanner has reached out to us through our website, allhealthtv.com, asking, "Hey doc, my wife and I have a bet and I need your help. I was raised thinking that brown eggs were more nutritious than plain old white ones. My wife Ashley grew up on a farm and laughs every time I bring this up. Dr. Kaur, who's right and who needs to go back to school?" Oh, Tanner, it looks like you're going to have to go to the store and get some school supplies. So let's talk a little bit about brown versus white eggs and why this might be or is a medical myth. Now, eggshell color is actually determined by the breed of hen from which that egg came. And it really doesn't change, at least not in a clinically significant way, the amount of nutrients or vitamins that are contained in that egg and the egg yolk and the egg white. For instance, white eggs have a slightly higher content of vitamin A, and brown eggs have been found to have a slightly higher content of vitamin E. And even though we have seen that the numbers might be a little different, they're not so different that they're really going to impact the health of a human body in any meaningful way or in a meaningful amount. Both provide similar amounts of nutrients, protein, vitamins, and minerals. So both are considered nutritious and healthy foods. Now, this may seem unlike what you're seeing out in the grocery stores or when you go shopping, because a lot of times brown eggs are marketed or advertised to be more expensive, and sometimes they're the ones with the term organic or farm fresh. So it may lead you to believe that those are healthier, but that's in fact not true. There's no scientific or clinical evidence that brown eggs are better than white eggs. Now, what you do want to look for, though, and I know a lot of times people can get confused because there's so many different types of eggs out there now, not just brown versus white, but you have organic, you have pasture raised, you have farm raised, and then you have cage raised, and it's a lot, I understand. But if you're going for health consciousness and you can get these types of eggs, pasture raised eggs are going to give you a little bit more healthy eggs, and that's because the birds have the freedom of running around, being healthy and happy, and they're not under constant stress, maybe such as cage raised birds might be. So that egg is going to come out a little bit healthier. Otherwise, white eggs, brown eggs, it's really a personal preference. Let's get to our next question. This one comes to us from Felicia, and Felicia asks, "Dr. Kaur, where do you stand on the eternal debate on drinking 8 glasses of water a day? I'm good for between 4 to 5, and then I'm pretty well hydrated. But am I doing myself a disservice by not downing 8 glasses a day?" Hi, Felicia. Thank you for sending in your question. And it's a really good one and one that I get all the time. But before I dive a little bit deeper into it, let's take a look at this video from our friends at the Mayo Clinic. was a wonderful video, not just to give us a little bit more clarification on how much water we should be drinking, but also it highlighted the fact that water doesn't just come from drinking, from tap water or bottled water, but the foods that we eat. So fruits and veggies can also have good water content and to keep you hydrated. So when it comes to how much water should I drink on a regular basis, that 6 to 8 water saying is kind of an old myth that's really not true. And the reason for that is while it may be a good generalization for most healthy people, people are different. We have different weights, we have different heights, we have different healths and health conditions. So how much water a individual needs really differs from person to person and what is going to be beneficial and optimal for them. Hydration requirements do change between people because of this. And you know what else matters? The climate that you live in. Do you live somewhere where it's cold, or do you live somewhere where it's quite humid and you're constantly sweating and you're hot and you're losing water through your bodily fluids, just like the video had mentioned? Now, studies have shown that optimal hydration is closer to about 2.5 to 3.5 liters per day to allow for adequate secretions and for adequate flushing of toxins through the body, most notably the kidneys, and for optimizing your metabolic health. But to get even more specific, we recommend a minimum of 40 to 45 milliliters per kg of body weight per day for your optimal hydration needs. And remember, this is total water intake, not just from tap water or drinking water, but fruits and vegetables and foods that might have water content as well. And of course, excuse me, coffee and tea also factor into this. Now, that being said, majority of us are not going to sit there and actually calculate, how many liters do I need? How many ounces are left? And how much does this watermelon have in it? It's just not realistic for everyday life. And I understand that. So when I talk to my patients about what is optimal water intake and a hydration for them, because we talk about water intake, but the point of it is to stay hydrated so our cells can work optimally and all the other parts of our body can be healthy. When I advise on this, I tell them that while that generalized 8 glasses a day is, sufficient for the most part, what you really want to look at is your urine color, and you want to monitor your urine for being dilute. So a light yellow or a light pale color. Doesn't necessarily have to be absolutely clear all the time, but as pale yellow as you can get it. Now, on the other hand, if your urine you're finding is frequently dark or heavily pigmented, yellow or mustard yellow, then that means you're quite dehydrated and you want to up your water intake for sure. And then the other thing you want to consider is your thirst. One thing that a lot of people don't know is that your thirst signals don't really come into play until you're quite dehydrated. So by the time you feel that thirst, your body's really asking for water. Obviously, you want to prevent that by regularly intaking water throughout the day. So, a cup of water, or you want to have a mug near you, or the video had mentioned some of those smart bottles that connect to your phone. That's pretty cool. I've actually never used one of those, but that's a pretty cool idea to stay on top of it. So that being said, don't get too caught up in the calculations and get stressed about, oh my gosh, I have to have, 62.39 ounces and this and that. Nobody's actually going to do that. And as physicians, we don't expect our patients to do it. Just make sure you're drinking enough water where your urine is dilute and you're eating healthy foods, fruits, and vegetables as well. Let's get to our next question. This one comes to us from Crystal, and Crystal has sent in a question from our website, allhealthtv.com, asking, Hi, Dr. Kaur. I'm a voracious reader, and my grandkids give me a hard time because I like to read mysteries in my favorite chair next to an antique floor lamp. It can't handle newer bulbs, so it doesn't give off the best light. Now that I need a new prescription, the kids are telling me I'm ruining my eyes by reading in soft light. What do you think, doctor? Hi, Crystal. I am so glad that you're partaking in your favorite hobby, reading. Reading is one of my favorite hobbies, and I wish I had more time to do it. Now, as far as reading in dim light goes, there may or may not be some truth to what your grandkids are telling you, and I'll talk a little bit about why. Reading in low light doesn't directly damage your eyes in any way, at least not in any permanent way. So it's not true to say, oh, reading in low light is going to damage your vision or damage your eye health. But it does put a lot of discomfort and strain on your eyes because, as you can imagine, when you're trying to read, especially if the print is fine and you're trying to read in low light, you're probably straining a little bit. You're probably squinting a little bit as well. And that is just putting a lot of muscular strain around your eyes. And then that obviously will result in eye fatigue. You can even get blurry vision if that's happening a lot or for a prolonged period of time. So if you're sitting and reading for hours, which is great for your brain because you're engaged and you're learning new things or you're exploring new things. But as far as your eye health goes, that's going to be a lot of strain on those eyes. And then it can also reduce your reading speed. So the pleasure of reading may be reduced as well because you're finding yourself not only squinting and straining and feeling eye discomfort, but you're not able to get through the book or the novel as quickly or as consistently as you would want to. Now, these effects are more pronounced the older that we get because, unfortunately, but understandably, as we age, a lot of parts of our body just aren't the same as they were when we were, say, 20 years old. So, naturally, as you age, there are some changes that occur in the eye. Some people at a lower degree than others, but some people may experience floaters as they age. Some people may experience reduced vision all overall as they age. And then there also may be some changes in the health of your eye. So your retina might change as you age and other structures that are behind the eye. And as this happens when you get older and these functions decline a little bit, then you're putting strain on them by reading in low light. It's kind of like a double whammy on your vision. And then that can actually result in discomfort and damage to the eye over a long term. So, all that being said, while reading in low light doesn't directly damage your eye, it can produce factors that can contribute to eye discomfort and disease moving forward. So, maybe try in reading in a more well lit area. Doesn't have to be super bright, but at least a little bit where you're not finding yourself straining and you can still enjoy your favorite hobby. All right, let's get to our next question. Oh, and in case you missed it the first time, here's how you can send in those questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
We have a question that came in from Instagram, and this one's from Trayvon. And Trayvon asks, Yo, Dr. K, my boy Derek and I run track at school. I'm a sprinter and he's long distance. So we're both stretching before our races. And to make a long story short, D pulled a hamstring, and he's out for the season. I thought stretching beforehand prevented all injuries. Is that not true? Hi, Trayvon. Thank you for sending in this question. And firstly, I hope your friend is feeling better and I hope his road to recovery is nice and smooth. When it comes to stretching before exercise or doing any kind of high intensity or sport activities, it is an important part of doing that activity in a healthy way, but it unfortunately does not always prevent all injuries. Now, the current consensus in medical literature is that whether it's static stretching or dynamic stretching, there's really no evidence to show that doing it is going to help prevent you from getting a pulled hamstring or any kind of pulled muscle or a joint injury or any other injuries, unfortunately, something more drastic even. It doesn't really guarantee that. But it doesn't mean that you shouldn't stretch before you work out because stretching regularly, whether or not it's right before a workout, regular stretching helps in so many other ways. It helps with balance, it helps with range of motion, and it helps keep your joints nice and mobile and lax. I'm sure you've heard of the saying, if you don't use it, you're going to lose it. Same thing for stretching and with those joints. If you don't regularly move them, in certain directions and stretch them out, they're going to get stiffened in place. And then that's going to be actually high risk for injury. So I know it's a little bit confusing. Stretching is really good for overall health and joint mobility and preventing injury and increasing your balance, but it doesn't guarantee that you're not going to get hurt. Sorry to say, but keep doing it. It's still very good to do. And again, I hope your friend has a fast and smooth recovery. Let's get to the next question. And this one comes to us from Leo from Facebook. Leo asks, Hi, Dr. Kaur. I remember my father often saying that one can never take too much vitamin C as it supposedly helps prevent colds. After being sick nearly every other week last year, I hoped to avoid a repeat performance and took 3 times the recommended daily dose every day last week. That may not have been the best idea as I'm currently dealing with a cold and have also spent the past few days with severe diarrhea. What gives, doc? Oh, Leo, I'm so sorry to hear this. You know the expression less is more? That might have been indicated here. And as always, too much of a good thing is not always a good thing. It can actually be a bad thing. And we'll talk a little bit about why. Now, in reviewing several robust studies, it was noted that routine vitamin D supplementation does not prevent colds or flu or illnesses in individuals who are otherwise healthy and well nourished. And that's the key. If at baseline you're eating healthy foods, you're a healthy person overall, you don't have any chronic conditions that are out of control, and you have a good nutritional status at baseline, adding extra vitamin C to that is not necessarily going to prevent you from getting sick because your immune system's already got everything that it needs to really be robust and at its optimal to, fight those pathogens and viruses and colds. However, in high risk individuals, and this could be people, the studies specifically that were done in people who are under excessive physical stress. So people who run marathons or are extreme lifters, sometimes even Olympic athletes, vitamin C intake actually did produce a 50% reduction in cold incidence. So in them getting a cold. And the reason for that could be, like I mentioned, they're under extreme physical stress. And when your body is under extreme stress, whether it's physical or mental, but physical for sure, then that does dampen your immune system a little bit. So that extra vitamin C could have helped in those instances. Other studies have shown that men in particular who have suboptimal levels of vitamin C, so maybe they're not eating enough fruits and vegetables and getting vitamin C from natural foods and natural items, they actually would benefit from vitamin C supplementation. And they had a 45% reduction in the incidence of cold. So they were 45% less likely to get a cold if they were having intake of regular vitamin C. All that being said, studies have shown that regular vitamin C supplementation has also been linked to an 8% reduction in the duration of a cold. So you mentioned specifically about getting a cold altogether, but what about when you actually happen to get a cold or the flu? Studies have shown that taking vitamin D regularly, so not starting when you got a cold, but if you were taking it regularly from beforehand, your symptoms could last shorter by 8%, and for children 14%, which that's great, honestly. But after you get a cold, vitamin C supplementation doesn't really help so much. The other thing that I want to also address is the fact that you mentioned that you're taking about 3 times more than the recommended amount or the daily amount, that can actually be dangerous. Now, when it comes to vitamin C, there's no real toxicity with it because your system will let go of, the extra vitamin C that it doesn't need, and it doesn't really store it. But it could still be harmful if you have other health conditions. So you always want to talk to your doctor before taking supplements and especially before taking more than the recommended amount. Now, I hope you feel better. Remember, when you're sick and you're not feeling well, the number one thing you want to do is hydrate, make sure your body's hydrate, and eat nutritional food so your immune system has all that it needs to fight that cold and get you back to being healthy. All right, let's get to our next question. And this one is actually not a myth, and it just came in from Facebook from Jacqueline. Thank you for sending this in, Jacqueline. She's asking, hi, Dr. Kaur, is there a sure way to diagnose hypothyroidism? I have all the symptoms: tired, losing hair, frequently cold when others are not, severe constipation, feeling out of the picture, and not so well. I have had thyroid tests that indicate my thyroid is low, but my doctor is concerned medicating me might cause me to lose weight. I eat extremely healthfully because I have rheumatoid arthritis. I don't eat fattening foods. Thank you for reaching out, Jacqueline. This is a really good question, and the short answer is yes. Now, the suspicion for hypothyroidism in an individual is raised when that person tells us they have certain symptoms, just like the ones that you're talking about. We then begin investigation with a series of thyroid testing through blood work. And if there's a clear cut abnormality that says, hey, this is absolutely hypothyroidism, then we move forward with treatment. And in the case of hypothyroidism, this is done with a medication called levothyroxine. And generally, this is a weight-based medication. So when it started, the dose is based on how much you weigh. Sometimes it can be started with arbitrary numbers like at 25 or 50, but either way, it's something that's taken into consideration with your individual status. And like with many medications, we always have to ensure that the benefit of the medication we're giving you outweighs any risks that may come from it. Because again, do no harm, right? Our intention is always to help you stay healthy and feel better. So the treatments that we give need to be aimed to do that as well. I encourage you to talk to your doctor and really ask her what her specific concerns are surrounding replacing your thyroid hormone or giving you supplementation, because then that might help clarify other things as to what is the most healthy way for you to get treatment for this. And it's especially important because you mentioned you have rheumatoid arthritis, and having uncontrolled hypothyroidism can actually worsen your rheumatoid arthritis symptoms, and it can actually induce flares as well. And if you're on medications for RA, having untreated hypothyroidism can actually make some of those medications not do what they're supposed to do. So as you can see, like with so many other things in the body, those two conditions are very much related and should both be managed individually so that they don't cause havoc in your body together. All right, if you've got questions, we've got answers. And again, here's how you can send them in to us.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Our next question comes to us through our website, allhealthtv.com. And if you haven't had a chance yet, I do encourage you to take a look. It's chock full of a lot of great information. Now, this next question comes to us from Reese, and Reese is asking, "Hi, Dr. Kaur. I took some time off and stopped training for marathons a few months back. And boy, did I go to town on sugar, carbs, and unhealthy fats. I'm sure I kept a couple of the local fast food joints in business. Anyway, it's time for me to detox, and I wanted to get your thoughts on juice cleanses." Hi, Reese. Thank you for sending in this question. It's so important because there's so much myth around the whole fact that juice cleanses can actually detox your body. And I know it may seem like a good idea, but it's neither necessary or scientifically proven to do any benefit. Let's start with the basics. No matter what you eat, your body has its own natural detox mechanisms, and these are primarily through your kidneys and your liver. When you eat fruits and vegetables, like whole, healthy fruits and vegetables, your body has all the right ways of extracting nutrients from them and doing what it needs to do to optimize your health and keep you, stable in a baseline. However, when you turn some of these foods into juice, they may lose some of their nutrients, their vitamins, minerals, their fiber content, that's for sure. And so you're not really getting all the benefits that you think you might be getting. So that being said, sometimes short-term juicing diets can actually promote inflammation in the body, and they can actually wreak havoc in your gut microbiome and the diversity down there. Now, you may have heard that the gut microbiome is very important in keeping your immune system healthy. And the more diverse it is, meaning the more different kinds of good bacteria, good fungi, good organisms that are down there, the better it is for your overall health. If you're doing a short-term juice diet, this might imbalance all the microbiome down there, and then that can actually lead to a lot of inflammation and cause unhealthy mechanisms in your immune system, particularly. So while it's okay to intake fruit and vegetable juices, especially if you make them at home, that is the best, and do it from time to time. While it's okay to do that, it's really best to get all your nutrients from actual whole foods and fruits and vegetables, and just let your body do its natural work to detoxify and keep you healthy. All right, folks. Well, that's all the time that we have for today. These were some great questions. I mean, the juice cleanse question, I get it all the time. Hydration, I know that's huge because everybody's always asking me, well, how many glasses of water are good for me? So, as long as you're drinking enough where your urine is nice and dilute, that's always important. And you want to make sure that you're staying healthy. As always, with any questions that you have, you're welcome to send them in to us or ask your primary care physician about it, because it's all about keeping you happy and healthy and preventing disease as much as we can. Again, my name is Dr. Kamaljit Kaur. It's been a pleasure. I'll see you next time here on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Funding for this program was brought to you by Michael J. Zinner, MD,